This week, Health Secretary Robert F. Kennedy Jr. removed all 17 members of the Advisory Committee for Immunization Practices, and he's already chosen 8 replacements.
In addition to making recommendations based on evidence, the group helps determine which vaccines health insurance covers. Joining us now to discuss potential consequences of the move, UW Health Dr. John Temte, who served as chair of the committee from 2012 to 2015. Dr. Temte, thanks for being on with us today.
Well, thank you very much for having me.
First question, does any of this come as a surprise to you?
Yes, it comes as a surprise because we didn't really expect the total dismissal of all current members, because that really takes away a great deal of that institutional memory and the people who know how to work within the system to get things done effectively.
Well, for those who are watching this afternoon and for all of us, what do you think the impact of this will be for all Americans?
The biggest impact, I think, is going to be within the legitimacy of vaccine recommendations. For example, if you go onto the CDC website today and look at the immunization schedules for adults and for children and adolescents, one of the things you'll notice is they have removed the American Academy of Family Physicians, the American Academy of Pediatrics, the American College of Physicians, the American College of Gynecologists and Obstetricians, and the American College of Nurse Midwives from the schedules. The schedules are no longer co-endorsed by all these groups. And this was unilaterally done on the Department of Health and Human Services end. But by making changes without working within the medical societies, you have now created a situation where there is disharmony.
Well, the 8 people that he has chosen, what do you know about them, and what's your opinion on any of their qualifications?
Well, one of the people who was chosen is somebody who served on ACIP when I was the chair, and is a good person, is somebody who is a well-respected pediatric infectious disease specialist. But then there are other individuals with a known track record for either not knowing much about vaccine science at all, or being people who espouse an anti-vaccine sentiment, which is not based on good evidence, but based on opinion.
Well, this isn't the only change that RFK Jr. is making. He's also changed the CDC guidelines, removing the recommendation that pregnant women and healthy children get the COVID vaccine. As a whole, what do you think of the direction that the country is going when it comes to vaccines?
Well, if you look at the whole vaccine enterprise, we have prided ourselves over nearly 60 years of having a collaborative approach where we look at evidence, we look at the individuals who are going to be receiving vaccines, we look at the clinicians who are going to be providing vaccines, and we try and come up with an approach that meets all those different demands and sensibilities. With the changes that were enacted this past week, these were done by a single individual without even consulting within the CDC. So the changes on the schedule, particularly removing women, pregnant women, from being a high-risk group to receive COVID vaccine, caught everybody, even CDC staff, by surprise. So these are not being done in the way that we engender support and engender confidence. They're being done by individuals with an agenda.
Well, Dr. Temte, thank you for talking about this with us, and we will continue to follow the story, so we may be having you on again.
We appreciate your time. Thank you so much.
Oh, and thank you very much. Take care now.